This person says, I have a history of keloid scarring, and I'm worried that this may impact my tummy tuck results or lead to more noticeable scarring after the procedure. How can I discuss this concern with my surgeon?
Be blunt about it, right? With any concern you have, like, I always tell patients, find your spiral notebook or whatever your thing, iPad, whatever, right? Everyone wants to bring in their tech these days. Ask every question. Don't be embarrassed. That is, you're usually paying for that time with us. And the idea is to get you should not leave ideally with a lot of questions unanswered. So I always tell patients, look, this is, I'm here, this is your time, let's go over everything. In terms specifically of the keloid question, it comes up a lot. I just answered this question with a patient a few hours ago in my office. And what would I tell patients is, number one, keloids in general tend to be more problematic in certain areas. Ears can get really challenging keloids, right? Something as simple as a piercing can lead to a keloid that engulfs the entire ear. The shoulder, you can get really bad scarring on shoulders. The back, so if somebody has a mole or something, or a mole in their back, sometimes those can lead to really, to scars that patients really don't like, whether it's a hypertrophic scar or a true keloid. Then there's parts of the body that seem to be a little bit more protected. So fortunately, face, where we hide facelift incisions, it's not a common area to get keloids. Breasts, I've probably seen 2 cases in my career where somebody had really substantial bad keloids from breast surgery. Bellies tend to do pretty darn well. We don't tend to see a lot of bad, whether it's C-section or tummy tuck, you don't tend to see a lot of bad scars.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. I personally am so excited about today's subject, tummy tucks.
Yeah.
Because I need one.
Well, you think you need one.
Well, I'm pretty sure I need one because of all of the craziness that went on in my abdominal section after 3 children.
3 big old kids.
Big babies.
Honey. And thank goodness we have Dr. Justin West joining us today. He is a board-certified plastic surgeon with more than 21 years of experience. He will be able to answer all of your questions.
I have so many questions.
And let you know whether or not you are a good candidate for a tummy tuck.
Exactly. Let's talk to him.
Yeah. Well, let's start at the beginning here.
All
Tell
over
us,
again.
No,
Okay.
I mean,
beginning.
as succinctly as you can, what is a tummy tuck and what does the procedure involve?
So here's a tummy tuck.
Okay.
People come in and they typically have skin that's hanging over their pants a little bit.
Okay.
Right? This makes them self-conscious, issues with fitting clothes. So we're removing skin and fat from the belly button down in a full tummy tuck. And then typically we're doing some liposuction as well because we're not 2D structures. We're all cylinders. So if you just take out the skin in the front, you get this flat front and then what looks like wings on the side.
gosh.
So most of us are doing what people will call lipo 360, where you're liposuctioning the front, the sides, the back, and cutting out the skin in the front. So you're cutting out skin and fat, doing some lipo so that it all blends well together to make that nice hourglass look. And then you're also tightening the muscles. So you talked about your kids and what they do to your body. So you get that separation. You get a rectus diastasis where, in an ideal world, your rectus muscles that give you your 2-pack or 6-pack or 8-pack, depending on how ripped you are, if you're an Olympic swimmer with a 12-pack. But they're typically locked like this. Well, as you have kids, they get stretched out. Now, sometimes they come together a little bit, but they rarely come back exactly the same. And then each time you do that, there's often more and more of a stretch. So we're also bringing those muscles back together, which is going to help you with your core strength. It's going to help you, from a functional point of view, but it also helps to kind of tighten that corset so you get that kind of pretty hourglass.
Well, and also, from what I understand, I had 2 C-sections and then I had a VBAC. But the C-sections destroyed my abs with the shelf, what you're talking about, and it feels like numb down there. Is that?
So the numbness isn't going to get better. Well,
okay.
Anytime we go in there, there's going to be some damage to skin, fat, blood vessels, nerves.
Wow.
And numbness is fairly typical for a C-section, and it's definitely typical for a tummy tuck. And in fact, usually it's a little bit more because when you do a tummy tuck, we draw sort of a tapered shape from the top of the belly button down to the hips. And then let's say from where that C-section scar back up to that same point. So you're removing what looks like let's say a football shaped piece of skin and fat.
That's crazy.
But now you have this
That's what I'm
big,
gonna be
so now
doing.
you have this big space you have to close. So we close that by lifting the rest of the skin up all the way up to sort of up to the breastbone, your sternum, and then that allows us to loosen it so we can pull it down and close it.
Oh my God.
And when you separate the skin like that, that's where you get the damage to the nerve that results in that numbness.
But the shelf will be gone because you're pulling so tight.
Oh yeah.
That's great.
Yeah.
And that's
the idea is to have a nice flat belly.
Yeah.
right. That's what everybody.
And then the C-section scar is gone too, from what I
Typically,
understand.
if somebody has an amazing C-section scar and if it's low enough, we'll sometimes go right into it.
Oh, okay. I don't.
If it's higher or if it doesn't look pretty, we'll go below it. We usually go a little bit lower, and you're essentially starting to scratch. That scar is long.
And you're moving the belly button, right?
Well, sort of.
Kind of.
What we do is at the beginning of the case, we make this sort of smiley face incision down below, right where the scar will end up sitting.
Right.
And then we make a circular incision or an oval incision around the belly button. Everybody does it a little bit differently. So the belly button, let's say it's here, right? We draw this, make this cut. And then you've got your smiley face incision down here. The skin from the top of the belly button down is what's coming out. Then we lift the skin up here and we bring it down like a sheet. So we end up burying the belly button, and then you make a new hole for it to come out. So you haven't really moved it.
So
You hide it and then you bring it back.
If I have an innie, will I get an outie?
Typically, people end up with an innie because we try to tack
innie.
it down. We everybody has their own sort of bag of tricks for how they like to handle the belly button. Some people make amazing belly buttons. Some people are clearly not.
Are you specialized? Do you specialize?
Are your
in
belly buttons
I'm not
nice?
sure. I have to update my CV and see if it says a belly button specialist. But no,
Yeah.
I think we've evolved to a technique that we like. That in fact, I had a patient on the phone the other day wanted to book another type of surgery, and she said, my favorite thing of all my surgery is my belly button. She's like, I was really
specialize in that.
So then you do.
I wouldn't
So
say
then-
it that way, but I think
so
I think the technique we're using right now does give us fairly consistently good belly button results. And sometimes it's the big tell, like where
Yeah.
somebody, you don't see their tummy tuck scar, when they wear a bathing suit or what they're wearing.
Yeah.
But you can look at it and say, oh, that's a really circular, fake looking belly button, and so that's a tummy tuck. If you do a great belly button and everything lines up right, you draw a nice pattern, the technique goes well, they heal well, all those things line up, you can get great results. Somebody can go to a pool with their friends and nobody knows they have a tummy
any
tuck.
the wiser.
Yeah.
No one's any-
Which is
I love that
kinda
it
cool.
can keep my innie. That's great.
We've been talking about a full tummy tuck, but
Yeah.
there's something called a mini tummy
is a
tuck.
mini, yeah.
What's the difference between the two?
So full tummy tuck will help you with skin excess that goes from the bottom of your breastbone all the way down,
Okay.
right? So you could have, sort of rolls of fat up here. You could have loose wrinkly tissue. It will make that entire abdomen flat and tight.
6-pack.
Well, yeah, I mean the combination of it depends on the thickness of your abdominal flap, right? So some people have some people are really thin and they have a very small amount of fat. Some people might have this much fat between their skin and their muscle, and so it's going to be kind of different outcomes. Flat, but not necessarily like a chiseled 6-pack.
I
And we can
see.
get into how you etch and all that stuff another time if you want to. So for a mini, it's for people who have a pretty flat belly from the breastbone down to the top of the belly button, right? That looks good.
Okay.
But they have excess skin from the belly button down.
Like the little pooch.
Yes. So if you have that, and ideally haven't had kids where the muscle is separated, that's an easy case. So we typically do a shorter scar, which is like a small extension of the tummy tuck. We don't always have to go hip to hip, and we basically take out an amount of skin. If the belly button's here, rather than going from let's say the C-section level up to above the belly button, we're usually doing something like this. So you're dealing with a really low, sort of a very limited amount of extra skin and fat.
But shouldn't you do it after you have kids? Like I know you said if you have.
Well, I mean, you might come in at, 30, 40, whatever age, having never had kids, but you've developed some laxity and some extra skin just at the lower part of your belly.
Oh, okay,
Might do
okay.
that. Or maybe you had one kid and you developed that laxity. The muscle might
see.
still be in really good shape. Maybe you didn't get that same diastasis because you had a really tiny kid. You only had one. You didn't have two. There's some things that line up.
I see what you
Some
mean,
things do
yeah.
that. Now, so if the muscles still lock together really well and they just have that very limited extra skin and fat, then the mini can be great. What's challenging is if a patient has diastasis where the muscle's separated, they only have limited skin down below, but they want all the muscle fixed and a short scar. You can do a diastasis repair through a really small incision. I do them for patients who are good candidates. It's a lot more work for us. People think it's going to be less expensive because it's a shorter scar and it's only a mini, but it's actually technically harder. It sometimes takes just as long because I can fix your muscle from here to here very easily through a big open incision.
Yeah.
The smaller the incision, the harder I have to work to do that. So sometimes it actually takes longer to
imagining
do.
that. Oh, I
But
don't
the
even know
cool
how
thing
you
is,
do
you
that.
get, if you're a great candidate, you still get the benefit at least of that shorter scar.
Okay.
But what a lot of surgeons just find it to be too much work, so they'll do the mini without. But they either don't fix the muscle, or they'll only fix the muscle from the belly button down, because it's just so much harder to go from the top of the belly button up if you've got a small window.
Exactly.
So
That makes
if
sense.
it's the right patient, I'll do it.
Okay.
If the plan makes sense.
And how long does the tummy tuck results last in general?
It depends on the patient. So if you what I always tell patients is, come into me at your happy weight, like a place where you're happy with how you look in general, maybe forgetting the extra skin and fat, but you've been there for a long time. Your diet plan's consistent, your exercise regimen, if you have one's consistent. You say, hey, I'm this weight and I've been this way for the last couple of years, and I kind of plan to be here.
That's cool.
Because then we can plan. So now if we do the surgery and we do our best version of that surgery and you're happy with what you look, well, as long as you maintain that same plan for diet and exercise,
okay.
you should be able to maintain it for a long time.
Okay.
Most people do, because they kind of had to earn that version of themselves, and they want to respect the recovery.
Yeah.
And sometimes they come in looking better at a year because they said, I was so happy with how I looked, I kept going. And I tweaked my diet and I tweaked my plan.
But
and
then
wow.
when you have excess skin again, like how does that
You know,
work?
unless-
if you lose more weight after.
We don't typically do the surgery on somebody who's, let's say, substantially overweight.
Right.
So we're trying ideally to have them do the surgery where if they continue to lose weight, it's not going to impact the results too much. Now,
Okay.
will it sometimes happen? A person might be able to lose 30 more pounds, but they don't want to because it's just not practical, or they're happy with themselves that weight, which is fine.
Right.
If they go on and change it because they think, oh my gosh, I felt so good about it that I improved my results on my own, and they create some laxity, it's easy to go in and just take out a little bit more skin. You're not going back to fix them. It's a different surgery.
It's a different
You're
surgery.
basically polishing instead
that's
of like
nice.
creating
A full time.
Exactly.
Well, I'm so glad you brought that up, because I have heard, just through my friends, not a doctor, that I need to lose as much weight as possible so that they can pull all. And so I've put a little pressure on myself before I do the surgery. I got to lose more weight, but I am sort of at my happy weight where I can cheat a few times, and feel good. So that's okay.
Patients are way more, they're sometimes hyper educated, right?
Sure.
And that statement's not totally wrong.
Okay.
We can usually get, the more, loose skin you come up with, the more of a change we're going to give
The
you.
more you're able to pull it.
But here's
that
my
makes sense.
counter argument to that is just simply this. I think if you're going to stay at that weight, fine. But don't
But if
go
you can't
past where you're
maintain it.
likely to live.
Yeah.
Then have the surgery that's going to cost you money, time, recovery, all those things.
Oof.
And then over a 6 or 12 month period, become less happy as you kind of drift back to the place you're kind of happy.
Yeah.
So do, if you come in and say, hey, I'm like 300 pounds overweight and that's my happy weight, well, that's a
Whoa.
different scenario.
Sure.
No.
It's somebody who's,
10 pounds
whose
or something.
body's kind of ready for a tummy tuck. They're going to get a pretty good result.
Mm-hmm.
And could it potentially be better? Maybe. But they can get a nice result at that happy weight. I think that's better than having somebody exercise to a certain weight that they can't maintain.
Dr. West, what alternative procedures or treatments for targeting the stomach area for patients who may not be ready or eligible for a full or mini tummy tuck?
Sure.
What's offered?
So for fat, I think one of the best things that we have right now is cool sculpting. So
Oh, okay.
yeah, I think it's it unequivocally works. We've seen very high profile cases where patients have had complications, right? It happens, but fortunately, it's a very small subset of patients. And the key is you have to have that conversation and say, hey, it's unlikely, but this can happen. But it's a great tool. I've used it for my mom. I've used it on my brother, two people who would never come in for lipo or tummy tuck.
Right.
But when they said, well, could I get rid of this little thing here? My mom, in my little black dress, when I go out to, the
LBD.
when I go out to like a play, when I want to wear something that's fitted, I feel self-conscious about this. I think my mom was probably 72 at the time.
Oh,
That's
wow.
awesome.
She wasn't going to come in, my mom's tough as nails, could do anything.
Sure.
But she wasn't going to come in for like a tummy tuck or lipo. But she said, well, if I can make this better while I, read, get work done, and not have to have surgery, she's like, I'll do that. And she did one treatment, was super happy.
That's
I had a brother who was never interested in any kind of surgical, but he said, okay, can I come in? I can come in and get work done while I do this, and I can look better and not have surgery and all the, he didn't want to do that.
Yeah.
But for essentially a very low commitment, yes. So I think for targeted areas, I think it's a great tool. For patients who have no intention of going to the OR, it's a great tool.
Okay.
Now, if you treat a lot of areas, and they're really thick, you're going to get a better result with surgery, probably.
Right.
And the price might end up, by the time you treat multiple areas multiple times, you could end up having an outcome that costs you just
More
as much.
than or just
But
as much.
if you are afraid of the OR or don't, or the kind of person says, I don't see myself having plastic surgery, but I could live with this thing that's not exactly plastic surgery, right? Sometimes it's just that little mental step. They just can't cross that bridge.
Of
You
course.
say, I would do this, but not that. Because they're like self-judging themselves for choosing
sure.
it. So I think it's a great tool. For skin tightening, there's all kinds of devices for non-surgical skin tightening or minimally invasive. The one that we like right now is Renuvion, that used to be referred to as J-plasma. Is it going to be the one that we all love in a year or now? Probably not, because there's this constant evolution in technology, right? So, 20 years ago, it was laser and laser lipo. Laser gave the best tightening, and then it was this and it was that. So, I would say it's not so much important to like lock in for anybody listening to the name of today's, du jour procedure.
Oh, okay.
But just to know that, yes, there are minimally invasive devices. There's this constant improvement. The issue is it comes down to the expectation. There's going to be some patients where that device that I just said we liked don't get anything out of it.
Okay.
On the other extreme, where people are going to say, hey, I'm really happy I did this. And then there's everybody in between. So you have to be the kind of patient who says, hey, I get that. It's not surgery where, you can mark here, and that's going to go because I get to decide that as a surgeon. It's not invasive. A large part of it is how does your body, your tissue respond to that?
To this,
and
yeah.
I don't control that.
Yeah.
The patient doesn't control that. So there's less control, which is not a surgeon's favorite thing.
Right. That makes sense.
But it's not as stressful if the patient accepts that. It's really stressful
Yeah.
if the patient doesn't, which means you really shouldn't be doing it.
Exactly. But it's a good option.
So if you are like Selah and you have decided, I want a tummy tuck, I know that's what I'm going to need because I need medical intervention now, how do you find the person to do your tummy tuck?
Well, I think it starts at home, on your computer. You Google plastic. Yeah.
I said the person, but I mean the surgeon.
Yeah.
Well, yeah. So but it starts with that, right? So
Sure.
plastic surgeons near me, best tummy tuck surgeon, best,
Referrals.
yeah, right. So
Sure.
start looking,
Friend
right?
referrals.
Friends can be great referrals, especially and the ones that had bad experiences can be just as important as ones that had good.
Absolutely.
But you start looking at their results. You talk to your friends, read about the surgeon online, and look at their photos. If you're
online.
having a tummy tuck, look at their tummy tuck photos. Just bearing in mind that some people, it's it's a lot of work to put up photos. You have to take them, and then you have to make sure you try to use the ones that are lined up as nice as possible. You have to get the patient's permission, and you have to get the permission from the ones that you want to use.
Right.
Then there's things that are tells. We say, well, if this patient could have an amazing result, but they have a tattoo, and that tattoo is like a signature that says this is who I am. So there's a lot of things that go into that. Where it's not always the patients whose results you want to share that you can, right?
Yeah.
And my philosophy is I never push. We just say, hey, that's a beautiful result. That's the kind of result that somebody's going to see tonight on Instagram or whatever, and call us tomorrow and say, hey, can I do that? But a lot of times that patient says, it just makes me uncomfortable. And you have to respect that, right? It's a big ask in some
it
ways,
is a
right?
big ask.
Even though there's no name and we don't,
I don't know if
that person has to know, hey, my
Yeah.
photos are, on this, out in the plastic surgery universe now. But look at photos and then go meet call the office, see how they treat you. If you like how they treat you, go into the office, see how the consult goes. Some doctors do a 5-minute consult. You can probably tell by how much I talk. My consult take an hour. And
I've done my
Block out
consult.
the afternoon.
now the difference, I
Today.
let my patients probably talk more than I've let you talk today, right? So I try not to totally dominate. So it always starts off with, hey, why are you here? What are your goals? And then I try my hardest to shut up and listen and write everything down.
Okay.
That's great.
And I say, like, what is the single most important thing? What are the give me 3 things. And we try to make sure that whatever plan becomes always respects those things that they've listed.
That's so great.
And you figure that out through the things they communicate verbally, and then you look at the wish picks, and those 2 things usually line up pretty consistently. And that their goals and their photos kind of give you the plan, and then your job is to make sure are they a safe candidate, and can you take that body they're presenting you and give them something that looks like the result. And if you can't, be honest. Say, hey, let's go back to the drawing board. Let's look for some other wish picks. I can't. Here's why I can't make your current your before look like thereafter.
That's
Right?
really good
Because you have
point.
to match
Yeah.
them, right? Because if somebody who's a 6'2" volleyball player, is going to get a different result than somebody who's not,
Right.
right?
That makes sense.
And so you try. I always say, hey, try to find somebody whose before kind of looks like you and whose after really resonates. That's the ideal. It just doesn't always line up that way.
right.
Sure.
But go and interview the doctor, and I would say meet at least 2. I mean, if you happen to like the first one, great. And if you end up going with the first one after 5 interviews, great. But different offices treat you differently from a surgeon's point of view, from a staffing point of view. And remember, the job doesn't end when that last stitch goes in. So there's a lot of follow-up visits.
Yeah.
How accessible are they? Every patient gets my cell phone, which
Wow.
because
What?
well,
That's huge.
when people, my philosophy is, you make it. It's a tremendous responsibility you're carrying,
Yeah.
and if you pick me to take you through that process, and it's 2 a.m, you shouldn't have to find some random doctor who happens to be on call for the practice, or have to go to an ER. And I can't tell you how often it happens. Where
Really?
I end up managing somebody else's problem, and you say, "Did you call your doctor?" Yeah, but nobody answers. You think,
Oh my.
Wow.
did you not? You must not have known that going into it.
Right.
Right.
So you will have to have a sense for what's that person's level of commitment. So that's one of the things that I think that you maybe. Some people do this naturally. For me, it was just lifetime stories as as somebody who became a second generation surgeon, learning the responsibility you have to patients, and
Yeah.
it often comes at a cost to you, your kids, your everything. But that's to me, that's kind of part of the responsibility of doing this job.
so
I mean, it's not
helpful.
supposed to be an easy job. It's a job with a tremendous amount of responsibility. It's not TikTok and Instagram sometimes has changed the way people look at us when you've got a surgeon dancing in the OR. At the end of the day, it's a serious job,
For
Yeah.
sure.
right? And you have to, it doesn't stop the surgery. It's how you care for the patient. Your the accessibility in the event that there is an emergency or just somebody feeling anxiety.
Yeah.
You need to be there to be able to help them through that process.
Okay, so as you have heard, I am doing this. I am doing the full mommy makeover. I want to know, what is this going to cost me? How much am I going to be out?
So, the answer and cost really there's a lot of factors that go into it. Where you're having the surgery done, what city, who's the surgeon doing it. There's a lot of variables. What I would say is everything that's done in plastic surgery tends to feel to me expensive.
Yeah.
Right. It's like buying a car in some ways. So you could have the same procedure, get a quote from 5 different people, and it could run the range from like a small car to an intermediate car to a big surprising car. But even at the low end, it feels expensive. And so sometimes patients are intimidated. There are very few patients who say, "Oh, I'll just go out to the trunk, get my suitcase of money."
I had that.
But it's checks, credit cards, and then it's financing because these things are expensive. The same way most people finance a car.
So you could use the CareCredit credit card.
Yes, we do it all the time.
Okay.
So, and it becomes like a great equalizing tool, right? So it means that you don't have to worry about, hey, can this, here's a great person's a great candidate. They're a nice human, and it would make such a difference for them. But then you feel guilty when they can't do it.
Yeah.
And we used to see a lot of that. People come in, they get really excited, and then there would be a sticker shock, and then they disappear, and you think, oh, it's really too bad. Like it would be transformative.
Okay, another friend told me, by the way, is this myth bust this for us.
Bust this
or
myth
fact,
for us, Dr.
Okay.
West.
that you absolutely have to be done having children to do the mommy makeover.
So
that true?
that's what we're always going to recommend.
Okay.
Now, it doesn't always end up that way, right? So
Really?
somebody will come in, say, I've had my 3 kids, I'm done. And then you meet them 4 years later and say, hey,
Surprise.
Oops.
add another kid.
Oh no.
So it doesn't mean that you can't, but most of us, the conversation typically goes, are you done having kids? Are you sure? Yes, I am sure. Okay, great. That's easy. Then there's people who say, well, I'm not sure. So we say, well, if you're not sure, like, why don't you see where the next couple years takes you? In the meantime, here's some things you can do to kind of really prepare yourself so that when you do come back, you're optimized and ready to go. And we don't have to talk about, getting to your happy weight. Is that you're done.
You're absolutely.
And then sometimes a year or 2 later, those people come back and say, yeah, I really am done and ready. So it's different for different patients. But yes, in general, we like you to be done with having children, so that you don't compromise anything about the pregnancy, and then you don't compromise your outcomes because it's not an inexpensive journey. There's time. There's a lot of there's a big recovery. So we don't want you to go through it twice.
That makes sense.
Yeah.
Yeah, absolutely.
All right, Dr. West, this is
Okay.
one of our favorites parts of the pod. It's
Ask
called
the
Ask the Expert.
Yes.
You're the expert.
Oh, okay.
Surprise. Oh, just to make that
I
clear.
thought there might someone else
No,
coming in.
no,
My
no one's
friend
coming
is
through
the
that door.
expert,
It's just
right?
you. It's just you
I just
want
want to listen now.
So this is the part where we ask questions from our listeners, okay? All right, here's the first question. I've recently lost a significant amount of weight, and while I'm thrilled with my progress, I'm now dealing with excess skin and stubborn fat in my abdominal area. How can I tell if a tummy tuck is right for me, and what kind of results can I realistically expect?
Okay, so without a photo, there's some big caveats here, but everything you've described is the kind of patient who typically gets a tummy tuck. I have a lot of loose skin that I don't know what to do with. Right. So there are patients who are lucky enough, as they lose the weight, they have amazing elastic skin and it just shrinks with them. And they could do a pure diet and exercise plan and they look amazing. Then there's the rest of us where you lose weight and the skin says, I don't care. I'm just gonna hang out.
Yeah.
Well, the way you deal with extra skin is to cut it out. So whether it's a skin only tummy tuck, a full tummy tuck, a mini tummy tuck, whatever the case may be, it usually means skin removal.
Okay.
Now, in terms of like what can they expect, it's an easier thing to show somebody in person. But what you can expect is not to have skin hanging over your pants. You can expect pants that fit you better. Probably having to buy a new wardrobe because you're going to be buying smaller things. So what you can expect is a lot of fun with your shopping when you're done recovering from your surgery, I guess.
This person asks, is tummy tuck surgery just as effective for men as it is for women? And are there any specific considerations or adjustments that need to be made based on gender?
It's a really good question. So at the end of the day, anybody can have a tummy tuck. If you have the physical exam findings, separation of muscle, extra fat, extra skin, or even just simply extra skin, you can absolutely have a tummy tuck. I think that sometimes we find, for whatever reason, that men sometimes have a harder recovery. I think by the time a woman's had a tummy tuck, she's been through a lot more physically. Right? I mean, men haven't been through pregnancy, which has got to be one of the most challenging things a human endures.
Yeah.
And I think women are just wired to process pain differently. If you poke me with a pin and poke my wife, I'm going to complain about it way more.
So true. This is so true.
But that doesn't mean they can't be candidates for it. I think that for it all really comes down to, it's not the gender. It's do you have findings that are something that can be helped with the surgery.
Okay.
And if you do, gender doesn't matter.
Okay. Interesting. You just might hurt a little more.
Well, there might be more complaining in your future. You know, and if it was me, that's exactly what would happen. This is not me talking poorly about my patients. I just think that we tend to handle these differently.
Yeah, definitely.
For sure.
Yeah.
This question is from one of our listeners, but this is something that I am always concerned about as a woman of color. This person says, I have a history of keloid scarring, and I'm worried that this may impact my tummy tuck results or lead to more noticeable scarring after the procedure. How can I discuss this concern with my surgeon?
Be blunt about it, right? With any concern you have, I always tell patients, find your spiral notebook or whatever your thing, iPad, whatever, right? Everyone wants to bring in their tech these days. Ask every question. Don't be embarrassed. That is, you're usually paying for that time with us. And the idea is to get you should not leave, ideally, with a lot of questions unanswered. So I always tell patients, look, this is, I'm here, this is your time, let's go over everything. In terms specifically of the keloid question, it comes up a lot. I just answered this question with a patient a few hours ago in my office. And what I tell patients is, number one, keloids in general tend to be more problematic in certain areas. Ears can get really challenging keloids, right? Something as simple as a piercing can lead to a keloid that engulfs the entire ear. The shoulder, you can get really bad scarring on shoulders. The back, so if somebody has a mole or something, or a mole in their back, sometimes those can lead to really, to scars that patients really don't like, whether it's a hypertrophic scar or a true keloid. Then there's parts of the body that seem to be a little bit more protected. So fortunately, face, where we hide facelift incisions, it's not a common area to get keloids. Breasts, I've probably seen 2 cases in my career where somebody had really substantial bad keloids from breast surgery. Bellies tend to do pretty darn well. We don't tend to see a lot of bad, whether it's C-section or tummy tuck, you don't tend to see a lot of bad scars. Belly buttons, even though it's not that far away, can be an area that's a little bit more challenging. When I say breast scars, this is an interesting example. So when we do a breast lift or breast reduction, often that scar goes across the entire bottom of the breast, and the bottom of the breast heals very well. If you move a little bit inside and you touch the skin on the sternum, which is right next to the breast, you can get a very tough scar. So what we do is, so if it's an area that we're expecting scars, we always counsel, and you can get a keloid anywhere. What we do for all of our patients is we always offer a really aggressive regimen to try to minimize scar. That's one of the reasons we see our patients frequently, is so that we can see them at all these phases of healing, where if the scar starts to look remotely challenging, we know, B, we can start to inject it with things like steroids to try to reduce that inflammation. We use silicone products to put on top of the scar starting about 7 days after surgery to try to minimize that risk. There's a whole host of products that we can do. The issue is they cost money, right? And so the more aggressive plans can often get fairly expensive. So patients who have low risk and don't care, they often choose nothing. Patients who are high risk, or they're just really concerned about getting the best potential scar, there's a whole lot of tools that we can apply to try to minimize that.
That gives me some peace of mind.
Yeah,
Truly.
definitely.
Yeah.
Well, this next person says, I've seen a lot of before and after photos of tummy tuck results online, but I'm not sure how to tell if they're realistic or heavily edited. I've wondered this too.
Me too.
What should I be looking for when reviewing a surgeon's portfolio, and what questions should I ask during my consultation to ensure I have a clear understanding of my potential results? That's a great
That is
question.
a great
It
question.
is.
Yeah, especially in
I
the
mean,
age of
it could-
Photoshop. Oof.
Yeah, and when I went through training, one of the things that they really drove into us was never adjust or alter your photos in any way.
Yeah.
The things that we are supposed to pay attention to is try to get consistent lighting, consistent background. Always try to shoot with the same magnification. Try to replicate your photos from visit to visit as well as you can. That's not easy.
Oh, yeah, that's not
None of
easy.
us are photographers, and very few of us have photographers in our office. When I was in Manhattan, they actually are the way we did it there is we actually did send every patient to get professional photos. But that was one way to address it, and they were amazing photos. But a lot of people didn't want to do that.
I was just going to say, I bet a lot of patients didn't want to.
Right.
Do that.
And most of us have high-end digital cameras, and we have consistent backdrops, and we try to light the rooms the same way, and then you walk into the room and all of a sudden one of your bulbs has gone out. So it's different from visit to visit. So there's a lot of variables you try to control. But yes, we very much try to be to get really consistent, reproducible results. I think with Photoshop, things that would be tip-offs would be somebody has a tummy tuck and you can't see the scar at all, where somebody's maybe airbrushed it, right? Like you're on the cover of Vogue. Somebody spent some time making, getting rid of every last imperfection.
Yeah.
That to me is kind of unrealistic. Like there's always a little, whether it's a fine white line or a fine red line, whatever the case may be, there should be something. Breast can be really hard to see scars. So I typically make scars at the bottom of the breast. It's called the inframammary fold approach. It's what most surgeons do. You can either put implants in through the bottom of the breast or through the lower edge of the areola. If it's the areola, well, we show that in our photos, right? And if you get onto our website, you can always see somebody's nipples and areolas because that's how we show breast photos. But if it's at the bottom, I can't find them on most of our website photos because they hide well in the natural
Right.
shadow. So that's not being dishonest. It's just the way that a scar would show. But even for those patients, sometimes when you look at it, when they're in the office, they can be kind of hard to see. But I would say, photos that almost look too good might be, especially if it's consistently too good, that might be a tell. But I think, in terms of realistic outcomes, I think what it comes down to is going back to this concept of, I think patients should bring in wish pics that really demonstrate as well as possible what they're hoping to look like. And the ideal wish pic is somebody where they say, this person is built like me. And they look, their before looks a lot like me.
Sure.
Well, if the person has a good outcome, there's a good chance that surgeon, or probably any surgeon, can get that same outcome for you. If your wish pick is somebody who's 6 feet tall, weighs 135 pounds, they're like a Olympic volleyball player who had a kid and maybe have a minor imperfection, maybe that's not the one to pick, right? If you're 5'1", weigh 160 pounds, find somebody who's 5'1", and we try to the extent that we remember to put things like their weight, their height. It is, every field you fill out, it's a little bit of work, but the photo you usually can tell you, hey, that person kind of looks like me.
Right.
So the best thing is be honest with yourself, and then hope that the surgeon is too. And then you usually can figure that out. If the person seems very salesman-like, I mean, if it's the same personality as the person selling your car, maybe they're glossing over things. You just have to, at the end of the day, though, you don't really know until you know, right?
Right.
So you have to go in, show them, be as honest about what you want as possible, whether it's implant size, whether it's, the type of results you're looking for. Show them the photos that really, truly represent what you want. Don't be embarrassed. If you want to be big, show them big photos. If you want to be really conservative, show them conservative. And then hope that they're doing the same. And if your gut tells you, I think I'm in the wrong place, listen to it.
Yeah.
Dr. West, is there anything we didn't ask you about that you would like to share?
Yeah.
I think this, anytime anyone chooses to do an elective procedure, I think you want to give it a lot of thought. You have to respect what this is. It's not a haircut that you can grow out of and just kind of forget and say, oh, I made a little mistake. It's a big deal. I think it's really important. The internet has all kinds of pros and cons, but a neat thing for patients is you can do a tremendous amount of research now before you ever meet your doctor. So I think that to get the most out of your consult, start reading. Get on different people's websites, Google terms. It's hard sometimes to kind of figure out what's real and what's not. But, at the end of the day, start learning the terms. I think you just look like a more educated consumer when you come in. I think that, again, like we've talked about, we talk about this with all the time with our patients, read about your doctors, see what people are saying about them, look at their results, make phone calls, see what different practices are like, and then go in and set aside some time. I mean, it's not easy to take out an hour of your day or 2 hours once you have the travel to go meet doctors. But at the end of the day, I mean, if I buy a car, I'll go to 16 dealers, and you spend time, and it's annoying, and
Yeah.
but you have, I believe in researching even simple things, and my car is not part of my healthcare plan, right?
Exactly.
Right.
This is something that's going to impact your life, hopefully in a really positive way. So put the time into it. It's worth it. Find it when you'll know you have the right team when you like their photos, you like their staff, you get the sense that they're going to take care of you, that they take this seriously, that they realize it's a medical thing. It's not, it's not foo-foo. This isn't silly stuff. It's serious. You want somebody who's going to honor the time that you're giving them and be respectful of that, and then do everything they can to get you the best possible result. And you'll feel that. I mean, I have patients tell me that all the time. You're my third, you're my fourth, you're my fifth consult, but I know I'm in the right place because even though this is now my fifth, I've learned more during this time. You spent more time with us, and you've conveyed that you care. So when you're on your journey, put the time into it, so that you're most likely to get that thing that you want.
Get the best
so
results.
great.
Thank you
So
so
well
much,
said.
Dr. West.
Yeah,
I
thank
know. We
you.
really appreciate you coming in and sharing this plethora of knowledge with us. And I just love your story. Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.